Good morning. Welcome to the Scope podcast. I'm Connie Rims, second-year medical student and SGA First Vice President at NYIT College of Osteopathic Medicine. I'm so excited to be your host for today's special podcast conversation, how to best transition to third year and board prep. Please welcome our special guest, third-year medical student and SGA President Alessandro Mercado.
Hi, thanks for having me.
And Assistant Dean of Clinical Education at NYIT Com, Dr. Nelson Ng.
Hi, Connie. Hey, Alessandro. Thanks for having me. It's a very important conversation today.
Thank you both so much for joining us. This is going to be a great topic to discuss. So let's jump right into our first question. So this is for Alessandro first. As a second-year student myself, a lot of students have registered for their board exams and they're starting to think about preparing for their exams. And it can be overwhelming when we're thinking about where to start. So how did you start board prep during second year, and what do you think worked and didn't work?
Yeah, I'd love to answer that. Thanks so much for having us, Connie. Yeah, I remember about a year ago today when I was a second year, just registered for UAssembly Step 1, COMLEX Level 1. Very, very stressful and very expensive. But I think the most important thing that helped me was knowing that the curriculum at NYIT Com was first and foremost my priority, because obviously you want to pass all of your courses because it'll set you up for success. So not neglecting my day-to-day schoolwork was important, but then starting to trickle in beginning in January, February, where we are now, was very important to start working on a little bit of UWorld or QBank of your choice so you can get exposure to those third-party resources to help with boards. Not overwhelming yourself. You don't need to do 40 blocks straight off the get-go, but trickling in maybe 5 to 10 questions a day, going them over in tutored mode helped a lot and helped to amplify the studies that I was already pursuing at NYIT Com.
I just like to say that board prep, it should be a parallel process. And it's really not the main event when you're in third year. And consistency is much better than intensity. So it's like exercise, right? You do 30 minutes a day. It's much better than doing 7 to 8 hours on the weekend. And I think Alessandro can contest to that. The other thing that you really want to do is tie the questions to the patients you see. I can tell you, I can read about Crohn's disease until I'm red in the face. I couldn't tell you what the symptoms were. But if you say, hey, that patient, Mr. Levine, I can tell you Crohn's disease, A, B, C, and D. So small efforts really do add up.
That's great. Thank you. I think consistency is really important. And like Alessandro was saying, staying on top of our curriculum, that sets up our foundation for board studying. So something to keep in mind. And as a follow-up question, Alessandro, what are some mistakes you think second-year students commonly make during board prep?
One of the biggest mistakes, and even one that I'm guilty of making, is overcommitting to the board prep before the coursework is actually done. Something that didn't really work for me was starting to do too many board questions, getting overwhelmed because they are very, very significantly difficult and you're not doing as well. You might get 30%, 40% on a block, and it sets you up for a bad mindset. And then you go back to the curriculum and you're not meeting it with the same energy you should be. So then you start doing subpar on some of your other exams. So my advice there would be to not overextend yourself, commit on doing well at your coursework. As Dr. Ang said, doing it even parallel. Right now, I think you're in GI block, so maybe doing some GI UWorld questions or GI TrueLearn questions to supplement and amplify rather than doing something completely out of the blue.
Thank you so much, Alessandro. And after our board exams, we're starting to think about preclinicals. So for you, what was the hardest adjustment when you started rotations?
Oh yeah, it's a completely different culture going from first and second year medical school where you see your classmates every day, your doctors, your professors every day, going into a hospital where you are in a different culture where people are working every day, you're seeing real patients. The biggest, most difficult adjustment obviously was showing up every day, being professional, being well-dressed, and being almost on your best behavior for both patients and also with the doctors, residents, NPs, PAs you're working with in addition to the nurses. Just carrying that same energy in and transitioning to third year meant showing up on time, showing up early, and also being ready to see patients as soon as you get to the hospital. So readjusting your mindset, knowing that you're not in first, second year anymore was a big, big change. Not to mention, some long commutes and long hours in the car.
From my perspective, you got to take a look at medical school as a whole. So the first 2 years, if you think about it, You're learning medicine in the classroom, lecture halls and the labs. In year 3, what's going on is you're actually practicing medicine, albeit under supervision. So there's a big shift there. And that's what Alessandro's, I think, trying to say, right?
Thank you so much, Dr. Ng and Alessandro. I'm really excited for my rotations later this summer, and I know it's a big transition. This is a follow-up question for Dr. Ng. What are some baseline knowledge, skills, or professional behaviors you expect students to have when they begin rotations?
Well, thank you for that question, Connie. Baseline expectations, I divided into 2 broad categories. First one is knowledge, and the other one is skills and behavior. So from a knowledge standpoint, no one is closer to the clinical work than you guys. And that's the expertise that you guys are going to be bringing to the hospitals, okay? So you've just studied and were sequestered for 2 years, learning biochemistry, anatomy, physiology. So you guys are going to be the expert on rounds. They're going to ask you what the mechanism of action for the new drug is. In addition to that, we do expect you guys to have some familiarity with the common diagnoses, regardless of what rotation you go on. For instance, if you're starting psychiatry, Alessandro, you better know something about anxiety and depression. So a good way to do that is to go to the NBOME website and take a look at those blueprints. They'll give you an outline of what you need to know and what you should be studying for your board exams and also for your shelf exams. The other thing we really want you to know is basic workflows. So as you can imagine, doing rounds on a newborn nursery is a lot different than doing rounds on a geriatric ward. From skills and behavior, be on time, prepared. Make sure you can introduce yourselves clearly, ask questions when appropriate, and accept feedback. And that's the biggie. Accept feedback and don't be afraid to ask for it.
That's really helpful. Thank you, Dr. Ng. Those are definitely skills I'll be keeping in mind. And out of these, do you see any challenges that students are facing commonly during this transition? And do you have any advice for students on how they can proactively address them?
Sure. I mean, I think the biggest challenge that students face is just feeling overwhelmed. If you can imagine, the wards and physician offices are fast-paced environments, not like on the pit in HBO. But the thing is, it's just as fast to you. And the thing is that the expectations are always unclear. We don't program every minute of every day for you. So as a student, I went through it myself. I didn't know where I was supposed to be, who was evaluating me. The other thing is the biggest trap I see students fall into is comparing themselves. They compare themselves to residents and they compare themselves to other students. Well, how you can mitigate a lot of this is just proactive communication. Yeah. Ask for feedback, be prepared, ask residents or your senior resident or attending for check-ins every so often. And about feedback, seek it. Don't wait for it to come to you. When you're on the wards, it's not about the students anymore, it's about the patients. So you tend to fall back in the queue.
I wanted to jump in if I could. Dr. Ng, that's very, very helpful and very applicable, especially I'm a third-year medical student on my clinical rotations now. I really want to emphasize what you said about expectations, because if we don't know what the expectations are, it's hard for us to meet them and be impressive as third-year medical students and make the most of our education. So what I've been doing that has been helping me a lot, especially even in my current rotation at St. Joe's Hospital for internal medicine, is I work with a different internist every day. We see the patients that come in from the ED that are new admissions, and they're going to be spending a night or two with us at the hospital. So with every new hospitalist I work with, I always ask, hey, what are your expectations? What are my responsibilities as a medical student? And their responses are so varied. Sometimes they want me to take a physical. Sometimes they want me to do a full H&P. Sometimes they just want me to shadow watch and chime in with anything I noticed on their history with additional history taking questions. So I think to add to your point, figuring out and calibrating your expectations to meet them with the doctors is a good way to ground yourself as a medical student and give you some sort of structure in a third year that's filled with so many different fun and rewarding educational experiences.
So, Dr. Ng, you mentioned feedback was a biggie. How do you think students should approach feedback during their rotations, especially when expectations can vary across sites and different preceptors?
I really sympathize with students trying to get feedback on rotations. The thing is, there are so many different scenarios that you go through, and preceptors come in all shapes, sizes, forms, and personalities. Some people are very receptive to giving you feedback, and others may be very stone cold. We understand that feedback is very subjective, but the thing is to approach it openly and with humility, because no matter how subjective it is, there's usually something you can garner from it. So I think the key is asking for it early, number one, and number two, asking it for frequently. So for instance, we require it on your evaluations, mid-cycle and at the end of the rotation. At that time, they're more summative in the evaluation, so they just go through a checklist to see if you did everything that you're supposed to do. When you ask for it at the end of a session or on a weekly basis, it becomes more formative, and they can tell you what you're doing well and what you're not doing well. And if you don't know, ask, what does doing well mean? I mean, that's a big question that Alessandro had really put forth. Yeah.
Thank you. I feel like rotations can definitely be overwhelming. It's such a different change in scenery and pace. And students, like Dr. Ng said, our priority right now as first and second years is just to study, study, study. And now all of a sudden we're in the clinical setting where we have to learn how to work in a team. So I think feedback is really important to that growth mindset. And this is a question for Dr. Ng. So beyond medical knowledge, what are some professional habits or mindsets you hope students develop during our third year?
Wow, that's a big one, right? First thing is to be reliable. So you have to follow through on things. In year 3, we really want you to take ownership of your learning. So we're not telling you to read chapter 1 and chapter 2 and chapter 3. You have to decide that for yourself. You have to be able to reflect. That's a biggie. Not only on the successes you had during the rotation, but on the mistakes you made. Doctors make mistakes all the time. The good ones tend not to make the same ones again. Okay. Now, we talked about how it's uncomfortable to be on rotations. A little bit of uncomfort is good because it teaches you to adapt. And what we want you to have is resilience. If you do all those things, you'll get what I call a growth mindset, and that will carry you way beyond medical school, throughout residency, and hopefully into clinical practice.
And to add to that, as a third-year medical student myself, professional habits, mindsets that help me so much, leave a good impression, maybe even get a slow or a letter of recommendation that I have been getting on my rotations is taking initiative, because nowadays, as third-year medical students, sometimes we're lost in the background because the patient does come first. But taking the initiative, being like, oh, can I try that? Can I do this under supervision? Helped me get a lot of hands-on exposure that I wouldn't have gotten otherwise, setting up IVs, drawing blood, and doing other procedures as a medical student has really, really helped me grow. And I think just being communicative and humble and using these habits that you build during third year help you leave a good impression for not only the healthcare team, but also for the patient. So bringing these into third year helps make it really as fun as and enjoyable as possible, because third year is really, you take out of it what you put in as a third year medical student. So bringing those attributes into the year, starting at your beginning, will only help you flourish throughout your entirety of the year and make the most of your clinical rotations.
Well, as a closing, third year is a transition in every sense. It's really not about being perfect, okay? It's about becoming a professional. So if you focus on growth, engagement, and learning from experience, I think you'll go very far.
That was great. Thank you so much, Dr. Ring and Alessandro. These are all things I'll definitely be keeping in mind. I think learning to be comfortable with being uncomfortable, and approaching each situation with a humble and open mind will definitely be helpful. So thank you so much again for sharing your valuable insights and experiences with our listeners. This has been such a great conversation filled with practical advice and recommendations, especially for second-year medical students. Thank you so much to our Valued Scope podcast listeners as well, and I hope everyone has a wonderful day.